he was actually admitted, presented to ED with the main chief complaint of less active and also vomiting post-fall from the bed during sleeping at home at 6 a.m. So, according to the mother, this was the first episode, and then the child was sleeping with the mother on the bed, and she only noticed the child had fallen down when she saw the child on the floor, and he was crying loudly. After that, because there's no fracture or red bruises on the scalp, so she was planned for monitor only at home. However, child seems to be more cranky, have episodes of vomiting and appeared to be less active. That's why was brought to emergency department at 8 p.m. So during the emergency department, mother together with the examining doctor was noted there is a redness over the forehead region post-fall. So clinically, the child doesn't have any sign of increase in ICP. Child was active. Neurologically, it was unremarkable. All neurological examination was normal. Vital signs were normal. No other bruises or injuries was found on other body parts. So child was proceeded with CT brain and noted there is evidence of subappendicitis hemorrhage and also there is occipital
subappendicitis.
Subdural hemorrhage.
Subarachnoid. Subdural subarachnoid.
Subarachnoid. Subarachnoid.
Subarachnoid lah.
Subarachnoid hemorrhage. And together there is occipital fracture. So case was.
This one you said parietal bone fracture as well. Okay.
So case was a child was admitted to the ward, general ward, which I was on call, and head circumference main monitored at the ED was 38.5, which was remained static in the ward, and the vital signs was remained stable during the admissions to the ward. There is no changes in terms of neurological examinations, and throughout the admission, his vital sign was remained stable. Case he was admitted and observed for 2 days in the ward and was referred to the child development team to rule out for scan. So neurosurgery input is for conservative management. Conservative, and then we have proceeded with skeletal survey to look for any other obvious fracture, but was none. So child was and then referred to optal team. There's no retinal hemorrhage. So child was observed for 2 days at ward and then discharged. Came to general GPC review for growth and development monitor. Growth was normal. So he was currently under 3 monthly review under us for the growth.
Okay.
Further history is in terms of according to the family history, this is a first child of both the parent. Mother is 35 years old, working as an operational manager in a private company, together with her father as well, which is the same age, 35 years old. They are staying only immediate family in the house. There is no caretaker, and normally when the mother went for the work, the child will be sent to the in-laws house to take care. So far, this was the first incident, and mother denies any history of shaking syndrome or any history of fall or injuries on other body parts.
So, any other history you want to take to rule out a shaken baby?
Shaking baby, says the history-wise, any history of seizure, any history of seizure, any history of fracture.
Any device equipment at home they could have used to make the child sleep?
Medications.
No.
Device or doctor that makes the child.
Device, anything.
Any device that makes the child.
What the important history that usually you ask if patient come with suspected?
NAI.
NAI.
Okay. So normally, is this the first episode or not? And then if it
No, I'm asking you what equipment they use to make the child sleep every time.
Pacifier.
Okay, some more. What else they normally use at home?
Normally,
Especially the
stroller,
any families.
The stroller.
Stroller. Okay, other than stroller. They use what?
Boyan tu I don't know how to tell in the English.
English boyan. Boyan is English cradle.
Oh, cradle, sorry,
Yeah.
cradle.
Alright. So they use cradle or not?
No history of cradle.
Okay. Alright. Okay. So how you want to manage this patient if you see this child from the first time? Okay, already settle all the acute part, the bleeding part, refer neurosurgery already, they say conservative. Then subsequently, you as a general pediatrician, how you want to like advise the parents?
Okay, in terms of that, okay, we have to advise the parents that there is no co-sleeping in the same bed. If the child have to be sleep, it have to be in different cot, and make sure the child will sleep at the edge of the cot, bed cot, and be edge of the cots, and watch out for and raise up the bed, the trails of the bed to make sure to prevent him to fall.
Okay.
And
Why they cannot sleep in the same bed?
because history of sudden death will happen because of the if mother sleep together, she will unconsciously will be compressing on the baby, which will cause asphyxia and death.
Okay. So what are the bedroom safety measures parents should know?
Regarding in terms of the shaking baby, the cradle, okay, make sure if it's advisable not to use the cradle, if used also to prevent at night. And then
Okay, some more? Okay, in general, what are the safety measures at home? In the kitchen, in the bathroom, in the bedroom? What are the safety measures that we should explain, advise the parents to prevent injury to the children?
okay. If there is a flight of stairs, make sure there's a trail that is being fixed so that prevent the child to fall, and then make sure that the sharp objects are being placed in objects. This is unreachable, and make sure that all the electrical or all the warm or hot to touch objects are being in the high place, which is unreachable to the patients, and if there is a toys or any furniture which is soft, and also the edge are very it's not a sharp edge object to prevent, because when the child is walking or cruising, to prevent the injuries to them. If there is any medications or any if the child is at the age of 6 months old, if there is an object, prevent those medications or any object that they can able to grab by patients and conceivable of them.
Okay. Some more? About the kitchen?
Kitchen is to make sure that the stove and also those sharp utensils, and also the stoves are in location which is far from the patients, reachable for the patient.
First, you must have a barrier for the babies or children not to go into the kitchen. Avoid all those dangling cords, because they can pull the cords and all the water heater and whatnot can fall down. If patient use the Koei kind of water dispenser,
Koei kind of, make sure it's in the far from the reachable, and
if they can still reach, what can you do?
Make sure that you have stopped you have off this switch.
No, since really some of this water dispenser is on 24 hours. Child lock. Don't forget about the child lock. They can child lock it.
Okay, child lock. Sorry, I never encountered before child lock.
Yeah, there is child lock safety measure.
Wow.
Especially the hot water one. The cold water don't really matter lah, but the hot water, yes. I think they should have some child lock safety measure for it. Okay. Then about the fridge and all that. Fridge, not really lah, but you can lock it with some manual lock also that you can buy extra for the fridge. Fridge not really much lah, but sometimes you store this kind of thing inside. You don't want them to have access to this candies and chocolate as inappropriate time. Okay, so yes, the stairs, yes, you put the barrier as well, and then the bedroom also, if they somehow put the barrier, the bedroom as well. Yeah, you must have separate bed cot for the babies lah. But the bigger children, some of them sleep with parents already. Okay, like 3, 4, 5 years old. I think it's pretty alright for them to sleep together. But if you leave the child unattended, you must have put some the borders barrier. Yeah, you can buy it separately from the bed as a bed, so that when they start rolling over during sleep to prevent the fall. If you don't have it, yeah, you put all those
The modified
pillows, whatever, the totos pillows, yeah, any, just to like prevent the fall injuries. Yeah, alright. What else, Bahru?
Bathroom is make sure that because it's slippery, make sure that it's slippery to avoid anti-slippery
Okay.
cord, and then make sure that the bathtub it's usually is emptied, and if it's able to, make sure that you put a cloth inside to prevent them to slipper and fall into the bathtub.
Okay.
And all the related shampoos and everything, make sure that it plays in the location which is unreachable for them. And the shower head is
What about the shaver, all the sharp objects?
placed in a cabinet which is unreachable for them, together with all the shampoos.
Okay. And then what about what else dangerous in the bathroom? Yeah. What about all these pails, basin, all this bathtub?
Turn it over so that prevent them to fall into it.
Okay. So what injury that they can have when you have those pail that fill up with water and all that?
They will have they able to drown inside and cause asphyxia.
Yeah, so they can have near drowning or drowning episodes because of it lah. Alright, so the general advice, if they go to the bathroom,
Make sure that there is a caretaker surrounding the patient when going
never
there.
ever let them
alone.
take a bath alone, or let them be alone anytime, at any time, even like 5 seconds, 6 seconds, because small babies, especially the toddlers, even the water level is very minimal. Once the head go in, that's it. So they can have drowning because of it lah. We have multiple cases, patient admitted because of near drowning due to just falling into the pail. It's not even swimming pool. Okay, yeah, swimming pool is another thing lah. Alright. Okay. So what else? What are the injuries they can have? Fall injuries, burn injuries, electrical thermal injury due to burn, electrical water heater. What else?
Thermal injuries, and then
Poisoning.
electrical
Poisoning because of
medications.
medications. What else? Other than medication?
Overdoses, toxicity of
Any chemicals, not necessarily medication. The chemicals, all the what? The soap, detergents, they're all chemicals, right? Yeah, we have many cases like alleged swallowing of certain chemicals, even perfumes. They're all chemicals, right? If they are unfortunate, the chemical is more like dangerous than the other. Yeah, so all these chemicals is really need to be stored properly. Don't have access. So the detergent, especially the washing chemicals, they need to be put separately, need to be locked properly, and all that. Okay, that's the safety lah at home. Alright. What about safety at other places like in the car?
In the car, make sure there is an appropriate car seat for them.
Okay.
And then make sure that they are being using the car seat belt. Make sure they are in the seat belt, and make sure that when If you want to leave the car, make sure the car is not being locked so that it's easy accessible, and don't make sure the aircon is on if the child is actually cannot leave the child unattended in the car.
Alright, yeah, we have many problem with forgotten baby syndrome. Alright, with baby who just like being left alone and parent didn't even remember that their child stayed in the car. Okay, then they die because of heat exhaustion, or they die because of sometimes they got asphyxiated as well. Alright, then what about the car seat? What is the recommended sitting arrangement? They should facing forward or facing backward?
Facing forward, doctor.
Until facing forward from what age?
Facing forward at age of like 1 year old. Actually, age of 6 months we already start. When they can able to sit supported, since then we can actually use the facing forward.
By right, you should facing backward as long as you can in children. By right.
Oh, okay.
That's the best way because it prevents the hyperextended injury lah. Hyperextension of the neck injuries lah. Because when you facing forward, when you get impact from the front, then you have this kind of reaction, right?
Yes.
You go forward,
And
go
you go
backwards. So when you go forward, you have this hyperextension of the neck. You get cervical injuries. Right. So when you facing backward, you car like this, baby facing like this. When they impact, so the neck is supported all the time. Right. So I'm not really don't really remember exactly what age. So as long as they can accept being facing backward, it is the best possible sitting arrangement. But most of the time, in the practical world, by 2-3 years old, most of the time they want to facing forward already because they are like to expose and all that. Yeah, at the moment, anyone less than 2, they should be facing backwards. But remember that facing backward is still the best lah, right? At the point they can like wear the adult seat belt with the booster seat, they should be facing forward already. Okay, as long as they can fit the child for infant toddlers, the best way is still facing backward. Okay, and then can you put the car seat in front? Or can you put the car seat in the front seat or not? Cannot. Why?
Because the risk of injury is higher.
Because of what?
Because there is a car,
What?
the window shield.
Not just window shield. What you call it?
What do you call it?
Airbag.
Yes, airbag.
What about the car that don't have airbag?
Car don't have airbags.
So it's just a point for discussion.
Okay.
If you've got airbag, by right you shouldn't put the child at the front seat lah. But some car has features where you can off the airbag. When you off the front airbag, the passenger airbag, that should be alright. Okay. If you put facing backward, I think that's fine. Okay. But most of the car they don't know how to off also. It's best to put child at the back seat. Okay. In older car, don't even have airbag. So I think that's fine also lah. Okay. Alright. But even front seat, back seat, as long as they can sit facing backward is fine. But the best place to put facing backward is always the back seat because you got space and then it will lean against your seat. So you got a lot more support. If you facing backward at the front seat is always the dashboard. So dashboard basically nothing. And then the screen also. Then all these mirrors and all that. Okay. Alright. So what about safety at going to the mall, going to outside lah. Safety at outside in regards to being kidnapped and all that.
Okay. Make sure that you are with the child, holding the child, and if the child is we are holding on the child, even the child there is a caretaker which won't leave the child alone. Sorry, doctor, I didn't know anything extra, but I didn't know.
To never leave child unattended at all time lah, basically. So most of the time, my parent got distracted. At the point they kind of like lost the child temporarily. So at that point, if got syndicate want to kidnap the child, yeah, they can be gone like in seconds. Yeah, it can happen. So always like pay attention to the child, especially where they're going, what's around them. If going near towards to the elevator, escalator, yeah, they should be very vigilant at all times to avoid being kidnapped, one, to avoid all these fall injuries, to avoid being separated. Then they get lost, even though they're not kidnapped. Okay, all right. Okay, I think that's all I got most of the time. Right. Okay.
Pet injury.